A customer shows signs of slurred speech and unsteady walking. As a responsible server, your best action is to A. Offer a stronger drink to help them relax. B. Refuse further service and offer water or food. C. Ignore the behavior unless they cause trouble. D. Call another server to handle it. Answer: B. Slurred speech and poor coordination indicate intoxication. The server must stop serving alcohol and encourage non-alcoholic alternatives. Which of the following is a valid form of identification for alcohol service in California? A. A school ID card. B. A foreign passport with a photo and date of birth. C. A credit card with a signature. D. A work badge. Answer: B. A valid ID must include a photo, date of birth, and issuing authority, such as a driver's license, state ID, or foreign passport. What should you do if a guest tries to buy drinks for someone underage? A. Serve the drinks as long as the person paying is of age. B. Serve only one drink. C. Refuse the sale and explain the law. D. Ask the underage person to leave. Answer: C. Servers must refuse service if an adult attempts to provide alcohol to a minor, as both parties can face penalties. Which is a common effect of alcohol on the central nervous system? A. Increased alertness. B. Slower reaction time. C. Improved coordination. D. Higher energy levels. Answer: B. Alcohol acts as a depressant on the central nervous system, impairing reflexes and decision-making. A person's blood alcohol concentration, BAC, is primarily affected by A. The color of the drink. B. Body weight and rate of consumption. C. The temperature of the alcohol. D. The time of day. Answer: B. BAC rises faster in individuals who drink quickly or have lower body mass, as alcohol is absorbed more rapidly. What is the legal BAC limit for drivers aged 21 and older in California? A. 0.02%. B. 0.05%. C. 0.08%. D. 0.1%. Answer: C. In California, driving with a BAC of 0.08% or higher is considered impaired and illegal. A visibly intoxicated guest insists on ordering another drink. You should A. Serve the drink and call security later. B. Politely refuse service and explain your responsibility under the law. C. Pretend to serve alcohol but use water instead. D. Walk away without responding. Answer: B. Responsible servers must refuse service and clearly explain it's against state law to serve intoxicated patrons. A guest who appears under 30 should be A. Asked to show valid identification before service. B. Served if they act maturely. C. Allowed to self-verify their age. D. Ignored if the bar is busy. Answer: A. The RBS program requires ID verification for anyone who appears under 30 to prevent service to minors. Which factor slows the absorption of alcohol in the bloodstream? A. Drinking on an empty stomach. B. Consuming high-fat foods. C. Carbonated beverages. D. Hot environments. Answer: B. Fatty foods slow digestion, reducing the rate at which alcohol enters the bloodstream. What is the primary goal of the RBS program in California? A. Increase alcohol sales. B. Reduce alcohol-related harm in communities. C. Promote happy hour specials. D. Help businesses earn tax breaks. Answer: B. The RBS program ensures servers understand responsible practices to prevent DUIs, underage drinking, and public intoxication. If a patron refuses to leave after being cut off, what should you do? A. Physically remove them. B. Ignore the situation. C. Notify a manager or security immediately. D. Serve them one last drink. Answer: C. Only management or security should handle removal. Servers should never use physical force. What happens to alcohol once it enters the bloodstream? A. It is stored in the liver. B. It circulates to the brain and affects behavior. C. It evaporates through the lungs. D. It remains in the stomach. Answer, B. Alcohol travels through the bloodstream to the brain, where it alters mood, judgment, and coordination. Which of the following is a sign of fake identification? A. Smooth edges. B. Uneven fonts or blurry printing. C. A hologram seal. D. A magnetic stripe. Answer, B. Fake IDs often have uneven text, poor image quality, or incorrect spacing in comparison to real documents. How long does it take the liver to process one standard drink? A. About 30 minutes. B. About 1 hour. C. About 2 hours. D. About 10 minutes. Answer, B. On average, the liver metabolizes 1 drink per hour. Serving faster than that increases intoxication risk. What is the safest strategy for pacing alcohol service? A. Offer 1 drink every 15 minutes. B. Encourage alternating alcoholic and non-alcoholic drinks. C. Serve stronger drinks later in the evening. D. Allow self-service. Answer, B. Alternating drinks and offering food helps slow consumption and maintain safer BAC levels. Which of the following is not considered a standard alcoholic drink? A. 12-ounce beer 5%. B. 5-ounce wine 12%. C. 1.5-ounce spirits 40%. D. 8-ounce wine 12%. Answer, D. An 8-ounce glass of wine exceeds the standard drink measurement, delivering more alcohol than usual. Why should employees complete the RBS training and exam? A. It's optional for new hires. B. It's a legal requirement to serve alcohol in California. C. It improves product knowledge only. D. It guarantees job promotion. Answer, B. As of 2022, California law mandates RBS certification for all alcohol servers and their managers. What should a server do after confiscating a fake ID? A. Keep it as proof. B. Destroy it immediately. C. Give it to law enforcement or a manager. D. Return it after warning the guest. Answer, C. Fake IDs must be turned over to management or law enforcement following company policy. A guest consumes 3 drinks in 1 hour. What is likely to occur? A. Reduced BAC. B. Elevated BAC and impaired judgment. C. Faster metabolism. D. Increased alertness. Answer, B. Rapid consumption elevates BAC quickly, impairing reflexes and judgment. When can a server legally refuse alcohol service? A. If the customer is intoxicated or underage. B. Only if the customer is rude. C. Only after manager approval. D. Never, once service begins. Answer, A. Servers are required by law to deny service to intoxicated or underage persons to maintain public safety and comply with regulations.